Yeah, Mangali, please go ahead.
Yes, ma'am. Very good evening to one and all. We welcome you to the Deccan Positive Mental Health webinar series. We welcome today resource person, Lieutenant Colonel Indra ma'am, counseling, psychologist, life coach, career counselor, yoga trainer, and we welcome participants and teammates on behalf of Manasa Subkara Mindcare Hyderabad in association with Yellowborn Counseling Center Hyderabad, India, 4S Creative Heart Studio, Punjab. Thank you. Over to intro section, ma'am. Thank you all.
Yeah, good evening, everyone. And thank you so much for that wonderful welcome address. And wish you all a very, very happy Republic Day. And our speaker for today is Lieutenant Colonel Indra ma'am, who is MNS retired. And the topic that she would be speaking on is let us navigate the flame by understanding and overcoming the burnout in the modern workplace. Ma'am is a counseling psychologist, a life coach, career counselor, and a yoga trainer. Ma'am, regarding an introduction to ma'am, she's a veteran officer with excellent clinical abilities and a successful career in military nursing service, an alumnus of CHAF Bangalore and a College of Nursing, AFMC Pune. A proactive nursing officer with passionate commitment to humankind, having expertise in intensive care, maternity care, pediatric nursing, and hospital infection control. She has been trained for HIV, AIDS, art, and hospital management. She has conducted and participated in various health camps and workshops during her service. She has served as a resource person for the training programs of newly inducted nursing officers. She's coordinated the training of nursing assistants and first aid training for NCC cadets. She's remained instrumental for setting up of the COVID ward, training of subordinate staff in handling COVID cases, and the use of personal protective kit. She served as a co-member in the Hospital Infection Control Committee and made a special impact in biomedical waste management. She's also received a commendation card by the General Officer, Commanding in Chief, Central Command for exemplary duty on the 14th of August 2019. Presently, with the objective of spreading holistic health awareness among the general public, self-employed as a counseling psychologist, a career counselor, a yoga trainer, after completing her MSc in counseling and family therapy from IGNO, yoga instructors training recognized from Ayush, registered with the Indian Yoga Association. She's a founder of Talking Cure Counseling Services in Dehradun, Uttarakhand. She's conducted various online and offline mental health webinars in schools and professional institutes, frequently organizes mindfulness workshops, online and offline mode for different sectors of the society. She teaches online and offline yoga to the general public. She owns a YouTube channel, Health Talk with Indra, for leaving no opportunity of health education. Ma'am has also some research publications to her credit. Attitude of Young Adults Towards Marriage, published in International Journal of the Recent Scientific Research, March 2021. Maternal Employment and Adolescent Socio-Emotional Development, a connection published in the International ISSN indexed online journal in Google Scholar, IIJIF, March 2023. With that short introduction, I would like to hand over the session. A very, very warm welcome once again to you, ma'am. The floor is yours. Over to you, ma'am.
Thank you so much, ma'am, for the kind words and introduction. Anita ma'am, Pankai ma'am. First of all, let me wish everyone a very happy Republic Day. On the occasion of this special day, I have got this opportunity. And let me share my screen first. And just a minute. First of all, once again, let me wish everyone a very happy Republic Day. And on this special occasion, I've got this opportunity to present my topic and uh, my gratitude and thank to the whole Yellow Pond team, Manasa, Shubhakara, Mindcare team, and special gratitude to Sunanda ma'am and Dinakar Rao sir and Mamgai ma'am and Anita ma'am. Thank you so much for inviting me and for giving for such kind words. And so let me start. My topic seems to be little a fancy topic, but then in the gist, because I just wanted to bring the impact of burnout, so I made it like a burnout, a big topic. Otherwise, it's just the burnout and its management in the workplace. So it's a flame which occurs, something happens, and how we can navigate it, and how we can go through it, and how we can overcome it. Let me just start with an introduction and a small story. It was the year 2017 when I was holding in charge of holding charge of ICU ward in Military Hospital Roorkee, and it was a place. It was a hospital, military hospital. Roorkee is a place where it is center of Bengal Engineer Services. So this crowd of people are getting trained over there. So it's a hub of all the people. When whatever problem those soldiers, whatever problem occur, they come there. And 2017 was also a year, if people remember, where the dengue cases were maximum, and a lot of dengue cases we used to receive. H1N1 was also introduced in that same year, I must say. And H1N1 is swine flu, and people were really scared. It was a first ever, like not first, I can say, but still it was a viral infection, and people were scared, and we too were a little scared. It's not that we are also human beings, and we were also a little scared to manage. It was a little bit becoming difficult. Then on top of that, ICU, at least one or the other patient used to be on the ventilator, and I was known to be a dedicated person throughout my service, and I was what whoever was the other person opposite to me would keep changing. The night duty staff also would be a junior person. You cannot leave so many responsibilities on that person also, and so the maximum thing has to be done by the in charge, because to be answerable, who is to be answerable to everybody. LP, local purchase things, everything is not available. The resources are always short in the government sectors, hospitals, and our army is no different. Things are less. So when there are a few things, then you have to put on for local purchase. So for it is itself on itself a procedure. It's not that you tell somebody to go and buy it from the shop. You have to fill a big form. That form will have to go to, and to be signed by various people. Then it will go to the medical store. From medical store, somebody will go and procure the things. It has to be through commandant signature, and so many things. It's going to be a long procedure. So the whole thing of administration, management, leadership, everything was on the show. It remains in the shoulder of the in charge maximum, and you are answerable to the seniors, to the juniors, and specialists, super specialists, everyone. At the same time, that particular time, my mother-in-law was not keeping well at home, and she was in the last stage of her vertebral cancer, and along with schizophrenia. So if we all know, we all are psychologists, we all know how difficult a schizophrenia can be. So because of all those conditions, I could not keep her in the hospital. She had to be managed at home. She didn't want to be handled by anybody else. So it was on my and my husband's shoulders. So we had to, and my house was a mini ICU. And though everybody was supportive to me, my hospital staff, my specialist, everybody was very supportive. My colleagues were supportive, but still, I did not realize, but I was going through a very difficult time. I was getting emotionally drained up, exhausted most of the time. I was not able to express to anybody. I had to keep up to the expectations of myself, may not be to anybody else. And the smallest task started becoming difficult for me. And all the big things which I feel that I used to do, I was finding it very difficult, getting nagging at small things, getting irritated most of the time. And it started showing on my body. I started having most of the time body aches, started having pain abdomen. And that pain abdomen was so severe, I never realized that it was because of this all conditions, these all situations which I was going through. And that pain, I had to undergo upper GI endoscopy twice, with nothing was relieved in that. And revealed in that, there was no result, and I didn't know it is a burnout. So, that was just a gist of the burnout, how it can impact what all would have happened. Now let us discuss about the origin. This gentleman, anybody knows this, can name this gentleman? Herbert Trudenberger. It was in 1970s, exactly. If we say, it was in 1974 when the term was first coined by Herbert Freudenberger, and who initially said that burnout is an impact. It was revealed only for the healthcare workers and the helping professionals in that field. He had initially coined this, and but then gradually it is now widely studied, and it has now become a significant issue, and it has been studied in the other professions also, which is impacting gradually the studies. And IT sector obviously at that time was not so vast, so maybe here it impacts maximum. So what are the three key components as identified by Freudenberger? It was the emotional exhaustion. Emotionally, a person is fully exhausted. The resources are not there. Cynicism or the negativism. Every time a person feels negative about self and about others, about the situations, whatever is occurring, person have got all the negative feelings, and negativity is spread all around. And the personal accomplishments, obviously, whatever we feel we want to do is not there, and there is a decrease in the personal accomplishment because of all the other factors. Coming to the definition of World Health Organization, it is an occupational phenomena conceptualized as resulting from the chronic workplace stress that has not been successfully managed. So this is the definition of World Health Organization. Prevalence, if we say, I went through a lot of studies when I decided to talk on this topic. So I went through a lot of, and no two studies matched. So for the sake of giving in the slide, prevalence is an important factor. So because this Mashlek burnout inventory, which is the gold standard, according to that, all those three factors, the studies on basis on the all those three factors which I said, it is the emotional exhaustion, depersonalization, and reduced personal accomplishment. And depending upon the stress, about the place, about all those things, the studies will vary. So healthcare professionals, it is 4.3 to 90.4% in the different setups. Counselors and psychologists, teachers, IT professionals. So if someone is interested in going through, I have made various studies, and I've gone through the various studies which I have given. I'll be sharing the slides, and in the Google there is n number of presentations and studies there. Research studies are there, and especially after the COVID, people have done various studies on burnout, and you may go through. So talking about the contributions, my friend Manju, she's a teacher in a secondary school, in a renowned secondary school, and she's a very efficient teacher, a very hardworking professional. And with all the school has got latest smart classes and everything, all the facilities. She's trying to learn and contribute to her maximum, because there are various technological advancements, as we know. During holidays also, she's expected to give her commitment. Parents are allowed to call at any time to know about their child, whatever are the problems the children are facing. Principal or the management, you may say, may call at any time, because there is a lot of connectivity now. It's not like earlier that a person is going to the office or school or wherever is the working field and coming back after 8 hours or 10 hours, and then only in the next day the person is going. So online and offline work has increased. So now of late she started becoming very she started finding it very difficult to balance between her home and her job, because she doesn't know when I have to look after my kids and my family, my husband, when I have to cook, and when I have to think about the my job. So she also started becoming finding it very difficult. So these are the contributions to the prevalence. Prevalence is obviously there, difficult situations of the ward, of the hospital, of the workplace. But then this technological advancements, in one side they are very helpful, but on the other side these are adding on to the problems. Now, talking about the 5 stages, somewhere 12 stages have also been explained, but I don't want to go discuss about the 12 stages. This is very that is very detailed. So let us discuss about the 5 stages of burnout. I would like someone to just unmute and talk about this first stage. If someone can say just by the name honeymoon stage, what can happen in this starts? Anybody if would like to unmute and say what it can be, what is the honeymoon stage, what can happen here? I would appreciate if someone, it's the way yes, Miss Priyanka Solanki has raised the hand. Kindly, can you, if you can unmute and say something about it? Someone would like to say? Okay. So as the name, yes,
Good evening, everyone. Kalyani.
yes, ma'am.
May I?
Yes, ma'am. Please, please.
I'm just trying, okay? I'm just
Yes,
guessing.
ma'am. Yes, ma'am.
Like, suppose you join an organization, okay? Initially, everything is very exciting. Everything seems to be fine because it's just the beginning, and, everybody is very nice to you, welcoming you, and all that. So I think that is the honeymoon stage where things are simple, and you're just very excited about the new job and, new people and everything. You're excited about everything. So I think that's the stage where everything seems to be fine and all good. So I think that is the stage.
Yes, ma'am. Very well said. Very well said. And it is exactly the same person. Like as the name suggests, person is with the full, like full of positivity, very
Yeah.
happy, getting a new job, joining a new organization, joining a new place, and person is filled with the positivity and optimism. At that
Optimism.
particular optimism is full of optimism is there. We are not able to see anything negative because everything is good. I had hoped for this place. I have worked hard for the long time to get to this position, and now I have to enjoy the fruit. So
Yes.
initially, highest level of job satisfaction is there, and that is the first thing which we say. And that time, a person is not able to identify, not able to make out what is the problem. And then gradually, what starts when there is a onset of stress in the second stage, there are a few days which are little more difficult than the other days. Days are okay, but the few days are bit difficult to manage. And then when it starts occurring at the continuous constant level, then that is the stage of chronic stress. When coming to the burnout stage, it is like continuing, it is now nothing is normal, things are not normal, person is finding it difficult to manage, and it is coming often, and some kind of intervention is required now. And then last one is that habitual burnout. In the case of habitual burnout, then it start causing problems in the environment, with the person, and the health issues. So these are the 5 stages. I have there is one more slide. If someone is interested, can read it later on. I'll be sharing this slide. It is given in detail in this, but basically these are the 5 stages. If we go through it, it will be a little boring, but we have actually understood what are the 5 stages occurring. Now, coming to the potential causes, let me talk about a typical you may be feeling that I am only discussing about the hospital because that is the hospital setup where I have worked, and these kind of situations you can correlate in your own profession, in your own organization, because the situations may be different, problems may be different, but then overall the feelings are same working in any place. So I want to tell about a situation, a typical causes, typical night in army hospital, RNR ICU. So RNR is supposed to be the research and referral hospital, army hospital, RNR, where it is a 21 bedded ICU. It has got one side of medical patients, one side with surgical patients, and there is a neuro side also. 5 to 6 beds are for the neuro patients, and total of 4 nursing officers on duty at in the night time. I'm talking about night, so 4 people are on duty, 2 in the medical side and 2 in the surgical plus neuro side they have to look after. At a given time, at least we'll have 7 to 8 patients on ventilator, and I don't think it is important to tell. It is like it is known that all the patients are bedridden. There is if a person is not on bed, not a bedridden patient will not be in RNR ICU. That person will be in some other ward. So minimum 7 to 8 or 9 patients will be, and where the continuous care is needed, a person is always on the toes. So the duty starts from 7:30 in the evening till 7:30 in the morning, handing taking over time excluded. So after 7:30 in the morning, for half an hour you have to hand over. It becomes 8 o'clock. After 8 o'clock, you have to go to the administration and give a report of the whole night duty. During this time, other than the work, many people will come for the round, and you have to take the rounds with them, and you have to explain about each and everything and the various procedures. Then reporting to the specialist and the super specialist. And then one great thing about this place is, in the morning you have to give report to commandant and to the PM. PM is the principal matron, who is the senior most person. And if that PM happens to be a professor or a principal who has just come from the College of Nursing, and she has taken over the place. So not exaggerating, complete 1 hour goes for reporting to her. So in the whole place, and the person doesn't know, and that night duty continues at least for 10 days, and it may be more. In that particular place for 10 days, in other places it is for 15 days. Person is having a monotonous workplace, chaotic workplace, lot of problem, isolation, lack of recognition is there most of the time, and the job expectations are there, because it is same type of job. Everything, you look after one patient who is on ventilator, and you do everything for that particular person. Go to the other bed, and when you just turn back and you see the ECG is flat on the previous monitor, and you don't know now what to do. You have just finished everything, and you have gone to the morning routine is there. You have just finished everything and gone to the other bed, and just to realize that somebody is telling, ma'am, this ECG is flat. So, and then you start doing things on that. And there is no work-life balance. Lot of imbalance is there. You don't know what is home, what is house, and it becomes very difficult. You're not able to control your feelings also, because the responsibility of looking after those patients, the outcome of the patient, it lies on a person who is on duty. So that is how, if the duty continues for a longer time, then it's going to be a very difficult thing. Now, talking about the main, we can just tell it in 3 things. When there is a demand resource imbalance. So any type of demand resource imbalance, it can be the resource, the physical resource or the mental resource. My expectations from myself also, I may be demanding more from myself also. I am not fully prepared. I have not catered for the problems, and my body is not prepared, and I want to give so much. I want to do so much, but I have not been able to fill in myself, my physical capacity, my mental capacity, emotional thing is not enough, and I want to give more. Lack of control. I want all the patients to become all right. I want everybody to be in shape 1 and become all right and go home. So is everything in my control? I want to control the things. So we can understand that we can only do things, but not take the control of everything. Lack of meaning. If somebody has a fall, so you can just explain it a little bit. If somebody had a fall, and there is some around 400-500 ml of blood has been lost, and in the contrary, if somebody has gone and donated that same unit of blood, so what a person who has donated the blood will be very happy. will feel grateful that I have been able to do something for the society. I have been able to do something for somebody else. And at the same time, who has lost 500 ml of blood will be keep crying. So there is no meaning. There is a lack of meaning, which becomes a main cause. Then talking about the organizational causes, there are various what is the culture of the organization, what are the various leadership styles, different types of leaderships which we have studied. We keep having in the different webinars when different types of styles are there. Communication, what type of communication is being practiced in the organization, and the expectations. A person who is expected too much, management is expecting too much, and but at the same time the resources are not adequate, and the recognition is not there. There is lack of recognition. So these are the organizational causes which are self-explanatory. What is the ripple effect? If something happens, the burnout is there, the effect is there, the ripple effect happens. The personal individual will have personal consequences, as well as the professional consequences will be there. Physically, personally, the physical and mental health will be deteriorated to the great extent. There will be no job satisfaction. It will reduce, because keep running around, keep doing things, and on top of that, if people are not becoming all right, if you're not been able to give the output, then there is no satisfaction, and overall well-being gets deteriorated. Professionally, the productivity is decreased, and there is an increased absenteeism and increased turnover within the organizations. Continuously, if there is a lot of turnover, then obviously the professional consequences will be grave. The outcome will not be so good. Then when there is let us discuss a little bit about the CBT model of burnout. When there is a stressful environment, a lot of stress is there, which is on coming again and again, people will have unhelpful ways of coping, doing party whole night, taking to alcohol, to drugs, to smoking. And this happens, people may say or may feel that helping professional or healthcare workers, they know everything, they know the have you seen, or you also must be having many people, many doctors who are smoking, who are taking alcohol. Don't they know what is the disadvantage of all those things? But then they land up to the unhelpful ways of coping, and smoking, drinking, taking to drugs, and going and on many other things which we all know. When they're not able to recharge in a right way, the negative thoughts are there about the self also, and then these keep coming and keep adding on. There is a lot of emotional exhaustion, and then again these things, this cycle continues. So if we have to address the strategies, talking to the strategies and addressing, so what we can do is, first is assess and monitor the symptoms. So what are the symptoms? First of all, we know these three. Basically, we have learned about the emotional factors and the cynicism, and about the decreased depersonalization. So what are the symptoms that are occurring in me? What are the causes? There has to be general causes and to the specific causes. Every person will not be affected by the same situation. A same situation, people will react in a different way under the given situation. So every individual is different. So in general, I may say that this particular thing can be the reason for causing the stress or causing the burnout, but it may not be true to me. I may be fine. For me, it may be something different. For somebody else, it may be something different. So in general, also people must learn the causes, and in specific about yourself also. And then talking to about the lifestyle factors, what going in detail. Am I having the real lifestyle? What are my lifestyle factors? How am I living? What am I able to do for myself? My obesity, diabetes, hypertension, and all those lifestyle diseases, how it is caused. So what are the factors which are affecting my lifestyles, my way of living? And then am I able to then working on the negative thoughts and beliefs? How am I able to handle those things, how those beliefs? Now, if there is a need, if it is required, after working on all those things, the new work related skills if my job requires a best communication, if communication, and I realize, I understand that I'm not good at communication, then I must definitely work on my communication aspect, my time management. If I'm not able to complete my task, then how can I manage? Because there are going to be only 24 hours, and the duty hours are going to be 6 to 8 hours, or whatever is the duty management, duty time. I have to manage. There is no other alternative. So what can be done? And the conflict management. So whatever skills are required related to my profession, it is my duty to update myself and to work on myself. Then leisure activities, what are the activities which can help me for recuperation, that is required, and relaxation, which is obviously a very important thing, and maintaining the progress. And what is the progress a register can maintain for myself, develop a plan for self, and avoid the setbacks. Coming to the individual strategies, yes, self-care comes foremost. Self-care is going to be the one of the most important thing. Setting of boundaries. Most of the time, this problem occurs when we are not able to maintain the boundaries. Work-life imbalance is there. So setting the boundaries that this much I am able to do with this much stipulated time, and how much of work I will be able to do. Time management, learning to say no. It's not always necessary to say yes ma'am, yes sir to everything. Mindfulness and relaxation techniques. See, mindfulness and relaxation techniques is not required that for 1 hour we do mindfulness and for 1 hour we do relaxation. These techniques, various workshops have occurred, and many times it has been discussed. If just for when there is a lot of problem occurring, just giving 2 minutes to yourself, just we can sit on the chair just for 2 minutes, focus on your breath, and take a deep breath, at least 2 or 3 breaths, a deeper breaths, and relax for just close your eyes for 2 minutes also will help in a longer run. So such small breaks can be taken and can be learned and can be taken. A social support definitely which is required, and it is the individual responsibility to find out the support system, look for the support system and the professional development. As I had earlier also said, if I am working on a profession, if I am in a profession and it is my bread and butter, then it is my duty to work towards my professional development and all the skills which are required, which I have to learn. And one person must keep updating oneself. Update is required. If you are not updated to the latest things and latest advancements in your own profession, then definitely things are going to be difficult. So have to find time and seek feedback. Seeking feedback from the seniors, juniors, and subordinates, the proper feedback that has to be done. Organizational strategies, again here, when it was in the year 2014 or 15 somewhere, I was working in MS Tejpur. It is 155 PH. It is in Tejpur, where we used to have, in all the places, we have got a great level of education. Education is given like in-service education is given a great priority. So we also used to have, most of the time, every week we would have, initially people don't like it, but every week we used to have some classes, some discussions, and some weekly preparations, demo classes of if the problems occur, if some problem is going to occur, then how we are going to handle. If some casualties are coming, if some mass casualties are coming, how we are going to manage, and how. So we used to always have plans ready at us, and we used to have dummy people would come with different problems, and we used to manage those people. So these things used to happen there. So once it happened that in reality I was on half day. So my half day was till 1 o'clock, from 7:30 till 1 o'clock. But then, as I said, handing takeover takes time, sometimes half an hour to 40 minutes. So it was almost 2 hours, 2 o'clock, sorry, 2 p.m. I reached to my home. As soon as I reached, I got a call that there is an emergency, and you must have heard about the convoys, the military buses. They used to come and go in. They come in a convoy. Convoy means one vehicle comes behind the other vehicle. So a lot of buses are coming, and people are going on wherever they are going from one place to another place, they go in convoy. They don't go in separate. So one convoy was coming, and from that one bus had a fall in the 20 feet ditch. And we all got a call. We all had to rush. About 30 people, 30 soldiers, they were injured, and everybody rushed to the hospitals. I had just changed and then just rush. It was told that in whatever dress you are, in whatever condition you are, you have to rush back. So we all rushed back, and it was such a beautiful management at that particular time, that nobody thought about their problem. That the people, the arrangement in the casualty department was so beautifully arranged. The surgeon was there, and one more specialist, one more normal one GD doctor was there, and surgeon was seeing all the people, and he was segregating the patients. Whoever had to go for x-ray was directly going for x-ray, then from there to OT or ICU or the normal ward, wherever they have to go. We all had gone to our respective wards, wherever we have to we were on duty. So we were segregating our job. We also had everybody, starting from housekeeper to ambulance assistant. Other time you can see people are just passing their time. Those people were also working at that time. So everybody was running around, and we didn't know how efficiently the things were managed. And that particular day, till midnight, till 12 o'clock, everybody was on duty. Everybody was in the hospital, and nobody was tired. So is it humanly possible that nobody is tired after working for so long? So it is only because of the organizational strategies, because of the beautiful management, the healthy work environment, and people's motivation, recognition, and appreciation. The training and resources, the training which we had already got, and the resources, we didn't know at that particular time from where the resources have come. Medical store was also there, and they were just supplying the things without us having filled the local purchase form. So everything was, we just gave a call and things were coming. Other times the lab reports, it takes at least 3 to 4 hours. The lab reports were coming very soon. And we lost one soldier at that time, and one soldier had to be shifted to Command Hospital, Kolkata, but rest all were fine, and things were settled within that time. So the organization has to see the effective leadership has to be there, and the workplace conflict, it also needs to be addressed. Creating a sustainable work environment, which is definitely needed, and which helps. If an organization has to work, then it has to be one. So sustainable work environment, it is everybody's responsibility, from the professional to the organization. And systemic strategies, again, their policy has to be reviewed again from time to time. And healthy work-life balance culture, same things are coming, inclusion in the decision making. And there is a need of training on burnout awareness. Since the term burnout is there, it is mandatory, it is a need of an hour that people know what is burnout. When I went through this burnout process, when I went through this burnout, I was not able to realize that I am having a burnout. I didn't know it is a burnout. It is only after that, when I studied about this, that this was a burnout. So there has to be a proper training has to be given, and people should be able to recognize the signs as early as possible. Flexibility in the roles has to be there. Proactively, what we can do, proactive measures are very important. The resilience, we had various lectures on resilience. It is the bouncing back from the adversity, how prepared we are when there is going to be an adversity may come to everybody. Everybody will have some or the other adversity in life, but everybody will not have the same reaction. So how much prepared, how much physically, emotionally, and psychologically prepared I am to go through that particular condition, that adversity, and how easily I am able to come back to the normal thing. So that is we have to work to a greater extent for this. Altruistic perspective, yes, definitely helping is everybody's innate nature. Everyone wants to help. So this altruistic perspective have to be kept alive. And this is how, because of this perspective, which I explained in our organization, when a bus had a fall, and how everybody was ready and nobody bothered whether they got food, whether they got water, everybody was able to work. Then understanding the brain and mind, it is a need of an hour for us to understand. Everybody should know. We earlier, when I did my presentation on anger management, at that time I had explained about the brain, how what happens, and how it affects, how stress affects our brain cells. So a person must understand the one's brain, and what are the changes that occur when there is a burnout. So it helps in a greater way. I will be able to understand that the problem is occurring with me by seeing the changes in me. So if I'm able to see the changes in myself, then I will know that some problem is there. Then only I can work on it. And meaning of life. Everybody gets up in the morning, brushes, takes bath, and eats breakfast, goes on duty, comes back, and gets some money at home in the end of the month. And then this continues for a few years, and then becomes old, retires, becomes old, and dies. So this is not, life is not all about getting up and going on work and coming back and sleeping and finishing your life. There has to be a meaning, and everyone has a different. We also had many presentations on meaning of life in this very platform. So it is my duty to find out what is the meaning of my life, individual's responsibility. So unless we find out, then this all has to be the proactive measures which we can take. So it is an ongoing process, and self-care, commitment to the self-care has to be. Self-care is one and most important thing, has to be committed. A continuous improvement has to be there, a healthy work environment, and attending to the early signs of burnout, taking the proactive steps, and addressing before they escalate, which is a need of, which is very important if we want to work on our burnout. So this is all I have to say. Self-care is your fuel. Whatever the road ahead or the path you have taken, self-care is what keeps your motor running and your wheels turning. Melissa Stegnes. So are you all burnt out or absorbed? We can have a small discussion, and house is open.
Yeah, thank you so much for that wonderful and a very meaningful, thoughtful session. It will be very useful for everyone to understand the concept of burnout. Venugopal, sir, you may go ahead, sir.
Okay, Indraji, this is an important topic for those who are still working. Yes. And just 2 weeks back, I gave a talk on psychology of burnout. It is on the YouTube. And in USA, nearly 40% of the internists, that means those who practice internal medicine, they suffer from burnout. Doctors. And I completed my MBBS in 1975. So I have been a medical practitioner for nearly 40 years. I never suffered from burnout. Reason is, you talked about time management skills and communication skills. That's not enough. 4 life skills are absolutely indispensable. Communication skill, time management skill, the other 2 are whole brain thinking skill and people management skill. They don't teach in the schools. I acquired these skills through self-education.